Now let's bring in epidemiologist and ABC News contributor now, Dr. John Brownstein, for more on this. Dr. Brownstein, good morning. You know, we're nearing 300,000 lives lost in the U.S. due to this pandemic. When do you think we'll start to see the vaccine making a difference in case numbers, hospitalization numbers, and most importantly, those death numbers?
Yeah. Hi, Diane. I mean, yes, we're seeing this convergence, right, of the brightest moments of this pandemic with the vaccine, with now the darkest moments with these new mortality numbers. And it's so wonderful to see these 2.9 million doses going out to over 600 locations across the country. You know, we're still needing this large numbers of people getting vaccinated to see the impact. So 20 million by the end of the year, that's great. I mean, we're going to see the impact on those that are most vulnerable and those that are at greatest risk of spreading the disease. So frontline providers and nursing home residents. But we have a lot of people to get through, right? 20 million healthcare providers, 80 million essential workers, and more importantly, that 100 million individual number of those with chronic diseases. So that's a lot of people. So by the end of February, we should start to see that population immunity going up maybe 40%, 100 million vaccines potentially by the end of March. That will start to see that impact on cases, hospitalizations, and deaths. So we'll start to see that impact, but it's going to take months. I mean, we can't expect in the next couple of weeks to see any changes in the numbers, and this is why we can't take our foot off the gas when it comes to controlling this virus right now.
Well, and on that note, you know, even after getting the vaccine, people are being told to keep wearing masks, social distancing, and washing hands regularly. Why is that, and when will we be able to stop? I mean, we should always be washing our hands, but when will we be able to stop, you know, wearing masks and social distancing and taking those kind of special precautions?
It's a question that keeps coming up. Everybody wants to take this mask off. Everyone wants to stop social distancing, but that normal life isn't happening tomorrow, right? First, we know that immunity takes time to build up, but more importantly, the studies, the clinical trials that were done did not actually look at the potential of spread from you to others when it comes to this vaccine. They looked at severe and moderate COVID disease, and we know that the vaccine can prevent that, but it doesn't necessarily tell us that we can't spread to others. And we know that asymptomatic transmission is still important. And this is why it's just going to be all about achieving that herd immunity and getting enough people on board with this vaccine. It's going to take months. It's going to take months into May, June before those masks start to come off and we start to get back to normal life. I know that's really hard for people to hear, but again, we're just right around the corner into the sort of brightest moments of this pandemic, if you can say it. So hopefully everyone can just stay the course for a little while longer.
And can you just explain that nuance a little bit more? Does that mean you could still get the virus, but you just won't get the disease, which is COVID-19?
Exactly. So this is where education is going to be so important, right? Because yes, the vaccine will help you because it will prevent disease, especially severe disease. We saw those numbers, 95%. But the reality is you could still be a carrier and have asymptomatic transmission. We just don't know yet. And it's possible that you still can transmit to others. And this is why you just can't stop doing what you're doing in terms of social distancing and mask wearing right now. I know that's a nuance, but it's such an important distinction when it comes to this vaccine.
It sure is. And our new ABC News Ipsos poll shows 40% of Americans are ready to get that vaccine right now. 44% say that they do want to get it, but they want to wait a little bit before they do. What do you make of those numbers? If we just have that first group, is that enough to reach a critical mass of vaccinated Americans?
It's not quite enough, but we're seeing those numbers improving, which is great because it was only about 50% a month ago. So, but this is a central issue. This is all about restoring confidence and trust in our vaccines. You know, vaccine hesitancy has a long history, goes back to smallpox and polio. We have a lot of work to do. The Operation Warp Speed name branding causes people to think that we rush things. There's so much misinformation and disinformation about mRNA online right now. The rumors are running rampant. And so this is why we need CDC, local public health scientists, all to help around science education. We need to achieve herd immunity. That's about 70% of the population. 200 million people need to get on board with this vaccine. So again, this is why education, really bringing people along, is so important right now.
And it's why it's so important that we have people like you that are gracious enough to take the time to talk to us and dispel some of those myths out there. Dr. John Brownstein, we appreciate your time as always. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.